medical debt and the struggles so many people have once they become patients, understanding all the bills that come after an unexpected medical crisis and whether they are fair. Here's Liz Kreutz.
3 years ago, Blake Pfeiffer went for emergency stomach surgery in Colorado Springs. He's a self-employed plumber and says at the time he couldn't afford insurance. He knew he'd have to pay out of pocket, but says the bills that came from the University of Colorado health system made no sense.
To this day, though, you still don't understand.
I still don't understand. I don't. No.
The initial charges for his 7-day stay, $104,000, which quickly became $58,000 because of discounts for being a self-pay patient. But Blake and his wife Dawn say bills just kept coming and without explanation.
We literally had bills scattered all over the floor, and it covered the entire office.
I get a bill for $20-some, and then I get a bill for $145, and then I get a bill for $75.
They say they stopped paying when no one at the hospital would explain the charges. Then they heard from a collection agency.
I did not like owing anybody any money, but I also don't like paying for something that I don't know whether I'm paying for it.
The couple went to a patient advocacy group for help and were told that at the time, the hospital wasn't publicly displaying many of the charges a new law required. But that wasn't the biggest issue. For some of the tests he received, Blake was being charged far more than insured patients were charged for the same thing. That's despite UC Health's own financial statement saying self-pay patients should typically pay a similar amount. Here's one example. UC Health's public price data showed the hospital was charging insured patients anywhere from $6 to $53 for a common metabolic panel blood test, depending on who the insurer was. But Blake's records show even after his cash discount, he was being charged roughly $103.
He didn't get a deal. He was actually charged over 2 times more than what would be a appropriate price.
Patient rights advocate co-founder Cynthia Fisher says the issue is rampant across the country.
UC Health is one example, and hospitals are using and hiding also not only their prices, but they're hiding behind aggressive collection agencies that are going after these patients.
In a statement to NBC News, UC Health declined to talk about Blake's situation, citing a notice of a potential lawsuit from his lawyer, but it did dispute the lawyer's allegations and noted that the state of Colorado has found their hospitals to be in compliance with transparency rules. The patient advocacy group also says the health system is now compliant with those rules.
Do you feel like there was any transparency in this process?
No. Nobody was interested in talking to us.
The Pfeiffers say their frustrations primarily stem from that confusion and lack of communication to help understand what the bills were for, and they now have this request to hospitals.
Be more transparent. Treat people like you would want your family being treated.
Liz Kreutz, NBC News, Colorado.